Hello friends, in this video we will talk about TS of medulla oblongata, the applied aspect and the nuclei present in the structure, medulla oblongata. Let us see introduction, the TS of medulla oblongata, three sections I will tell you, applied aspect and what are the cranial nerve nuclei. This is very important. So medulla is the lowest part of the brainstem. Brainstem is having three: midbrain, pons, medulla oblongata. Now we are going to discuss this medulla oblongata. So three levels will analyze: sensory and pyramidal decussation, that itself, okay, and at the level of olives, that is inferior olivary nucleus. So let's see at the level of pyramidal decussation. What is it? So we are having fasciculus and nucleus gracilis. Now in place of gracilis, just add cuneatus, that's all. So fasciculus and nucleus gracilis and cuneatus. Then SNT5, that's the way to remember, spinal nucleus and tract of trigeminal. This is the lateral corticospinal tract, posterior spinocerebellar tract, anterior posterior spinocerebellar tract. Spinal lemniscus, this is the spinal nucleus of accessory nerve. Now the pyramidal decussation, these are the pyramids. Arcuate nuclei will cover this, okay? Just remember. Let us see at the level of sensory decussation. What is there? We have nucleus gracilis and cuneatus, okay? This is accessory cuneate nucleus. Same as we said there, spinal nucleus tract of trigeminal. Here internal arcuate fibers, they will decussate. So sensory decussation. This is the medial lemniscus. Remember, there is, instead of MTR, only M is there. That is medial spinal tract. Reticular formation. Okay. Inferior olivary nucleus. Okay. So what are this 1, 2, 3 here? So one is NTS, nucleus tractus solitarius. I told you about this in the taste pathway. Please see the taste pathway video. I discussed in detail regarding NTS. Then dorsal nucleus of vagus. So vagal nuclei. This is the hypoglossal nucleus. Surrounding that should be what? The white matter. Obviously white matter. Outside we should have the gray matter. Okay. Alright. So this is, as I said, medial longitudinal fasciculus or fasciculus. Okay. And we can see here the pyramid with the arcuate nuclei. Now this is at the level of olives or ion, inferior olivary nucleus. Let us see. This is hypoglossal nucleus, MT, medial and tectospinal tract. Instead of rubrospinal tract, what we saw in the pons and the midbrain, we are having the medial lemniscus. This is olivary nucleus, inferior olivary nucleus. This is Na, nucleus ambiguous. From this we are getting vagus nerve, dorsal nucleus of vagus, NTS, vestibular nuclei, spinal nucleus tract of trigeminal, inferior cerebellar peduncle. Where have we come across superior cerebellar? Our pons, there we have seen superior and middle cerebellar peduncles. Then arcuate nucleus and the pyramids. Okay. Okay, so this is regarding the sections which I have told you, the sensory, pyramidal, decussation and ion. Okay. Let's see the applied aspect. We have medial and lateral medullary syndrome. Let us see with medial medullary syndrome, ipsilateral, contralateral. So pain and temperature, it is there in both ipsilateral, contralateral. Please remember, ipsilateral, contralateral, pain and temperature is involved. But the difference is this. In ipsilateral, spinal nucleus tract of trigeminal, but here spinothalamic tract. This is important. Extra, we will be adding head and neck muscles due to nucleus ambiguous, ataxia, cerebellum. Please always remember forever, cerebellum lesion causes ataxia. Okay. Now, lateral medullary syndrome. Let's compare. Ipsilateral, there is a lesion of the tongue. What was it here? Pain and temperature. Here it is the tongue lesion. What is supplying the muscles of tongue? If we know that, it's very easy. 12th nerve. But exception is palatoglossus, that is the pharyngeal plexus of vagus. And contralateral, we have hemiplegia, position and vibration. Hemiplegia is due to the pyramid, position and vibration, medial lemniscus. Okay. So let us see the cranial nerve nuclei in the medulla oblongata. So what are the nuclei? 5, 8, 10 and 12. So I'll show you the nuclei. One, here we are seeing the 12, 10, 8, 5. This is 5, 8, the vestibular part, 10 and 12. Okay. Now 5 is having SVE and GVE. Okay. 8 is having SSA. If I remember for second nerve, 8 is very easy. It is very similar to second nerve, that is special somatic afferent. By the way, here SVE and GVE, special and somatic and general visceral efferent. And 10th, it is very easy. Please remember facial nerve. Please recollect facial nerve once. It is very similar to facial nerve. Same thing, SVE, GVE, SVA and GSA. Extra only GVA is important. These four we have seen in the facial nerve. I have explained to you in facial nerve. Extra one important we have to add, GVA. So if we know facial nerve, it is very easy for the 10th. And 12th is GSE. 12th is going to supply what? Our tongue muscles. And 10th, just palatoglossus it will supply. Okay. And also not only that, it will supply the pharynx and the larynx muscles. Okay. And now 8th one, this will supply what? Our vestibular and the cochlear parts. It will supply the internal ear parts. 5th one is supplying muscles of mastication along with temporomandibular joint, the first arch derivatives also. Now references from where I took the pictures. That brings us to end of the video. So thank you so much. I'll see you in the next video.